Hello, my dear friends, and we would like to welcome you to my first presentation on Cannafestu, and I would like to appreciate this wonderful forum for everybody, including this fair, this cinema program, and wonderful professional program. And I would like to say many thanks to organizers, bringing here very good researchers and professionals from all over the world in the field of cannabis. Thank you very much to coming here. And I would like to present myself. First I would like to review shortly my points for presentation. I would like to speak about my long way from conventional psychiatry to medical cannabis and how I get to this point. And I would like to discuss with you what we mean under the name of the medical cannabis. I would like to review medicinal and recreational use of cannabis and current medical cannabis programs existing in the world. Maybe not of them, but some of them, sure and short, we will speak about them. I would like to give us some practical things on using cannabis as a medical substance, and maybe we will have time to see our research projects on neuropsychiatric uses of cannabis, and we will discuss the further direction of research. And again, thank you for your attention. Now I have a position in non-government and private healthcare association as a neuropsychiatrist, and have no any commercial interest in this field. I was graduated in Moscow Medical Institute about 20 years ago. I was specialized and fully certified in clinical psychiatry in Israel. Also, I was certified in adult psychiatry, biological and forensic psychiatry, and specialized in psychopharmacology and neuropsychiatry in Vanderbilt Medical Research Center, Nashville, USA. I had a very good career in Israel in the field of regular psychiatry, and my highest academic degree was a lecturer in Department of Psychiatry in Faculty of Medicine. Also, I was a deputy of president of Israel Association of Biological Psychiatry. So I had a lot of do with medical devices and mostly with pharmacological agencies like drugs, and worked with several pharmaceutical companies in obtaining the grants and making a lot of psychopharmacological research in Israel and abroad. But at some point of my career, 4 years ago, I was fully disappointed on what's happening in this field. And I decided to look closer on what is happening at this point, because being a chief physician, chief psychiatrist of post-traumatic stress disorder unit, I was aware that majority of my patients are using cannabis as a medical substance, which probably relieves a mental state, and I began to look closer to this. In this particular point, Israel government decided to allow cannabis to be used as a medical substance for many various indications, including post-traumatic stress disorder, depression, Tourette syndrome, Parkinson disorder, and other diseases such as Alzheimer's disease and many other indications. Now, after 4 years of intensive research in this field, probably 50% of my time devote to cannabis activity in Israel in the field of medical cannabis, and try to be a most competent medical cannabis physician in Israel. Also, I'm working on international level, and for 1 month ago, I was elected as a board member of International Association of Medical Cannabis in Köln, Germany. We had a wonderful meeting, and I invite everybody of you to be a participant of this meeting. Will be held in the each other year, and I will invite you to be there in order to study and learn a lot that can be done in this field. First, we should define the field we are working about. I would like to say that we mean, under the name of medical cannabis, we mean the use of cannabinoids containing substances for treatment or relieving of identifiable physical or psychological conditions within appropriate medical setting under relevant, sometimes close follow-up and monitoring, requiring continuous therapeutic alliance and mutual responsibility, collaboration between all caregivers, mostly healthcare professionals, and also including family members and the patient himself. It also means that some conditions and even some continuous and even constant users of cannabis may be considered and qualified as a patients, as a possible patients, or mostly based on the results of the serious and thoroughful serious medical evaluation, which could be identify the debilitating physical or psychological condition that might be relieved, probably, with the cannabinoids, and their awareness of this and the readiness to enter the therapeutic alliance and the program. So we suppose that only patients that could collaborate with the doctors could be considered medical cannabis patients. Therefore, the attempts made by the activists of the cannabis marijuana legalization to push forward an issues of medicinal use of cannabis compromise and compromise all our efforts made by some medical doctors like me and our researchers to bring cannabinoids to contemporary pharmacological armamentarium. These activists simply endanger the whole project. They just do not understand the current situation and are not aware at all how deep the resistance of the authorities in all over the world, and the most important, the resistance of medical community, which is so conservative in this nature and highly reluctant to any new methods of treatment, especially with a such kind of controlled substance such as cannabinoids in any form. So we medical professionals suggest to all local and international pro-free cannabis activists to step down from the medical cannabis advocating, since the compromisation is so obvious, and to concentrate the efforts on changing the current legal status of the cannabis or marijuana in the countries and in the world, using the existing mechanism for implementation of the human rights, but not more. I put this slide as a result of yesterday's lecture of a young lady from States that stated that Dr. Mikuya, who is a reinventor of medical cannabis in the United States, one of the fathers of current directions, and I just looked for his lectures that I downloaded from the web and looked on them closely, saying what our father in this field said about it. And he indicated closely that no cannabis abusers encountered who are functionally and happy could be encountered for medical cannabis. Also, contextual importance cannabis is a tool to the use of which depend of each personality, set and settings. About the abused patients, he said, we should look for each case as its individual case. Is it abuse or dependence? And how we relieve both of them. Also, he emphasized the need for adequate assessment for underlying psychological and situational factors. I would like to emphasize that Dr. Mikuria, past Dr. Mikuria, was a very responsible physician. And he supposed that the solution of medical cannabis story could be restore cannabis to formularies. And he suggested to initiate a 20-year study for benefits, risk, and therapeutic properties using all available contemporary technologies. He stated it about 13 years ago. So if we would come to this way, after 7 years we could have good results that we could place before authorities and say what we reach in this field. But it was not done systematically and very episodical mean, unfortunately, of course. So where we stand now, with cannabis, which is most uncontrolled among the controlled substances, we should say that no controlled commercial production was done till last 13 years. No regulated medical use. Only synthetic cannabinoids, mainly containing THC in various concentrations, are available. There is massive increase in use and abuse since the 60s. Also and awful, there is a biological confusion of the tongues speaking about medical cannabis. The global dilemma is that cannabis is a drug. Cannabis is supposed to be dangerous and addictive and cause psychosis. Also, there is other version that cannabis may be medicine. Cannabis could be used safely. Cannabis is not more dangerous than coffee. Cannabis only has mild side effects. But we know that according to the schedule, cannabis is put in the Schedule 1 drug, fully controlled like opiates. Cannabis, the states, all states who signed United Nations resolution, they say that cannabis has no medical value. It is drug approval process only. Also, they suggest in the last year that cannabis could be allowed as a soft drug. Cannabis is allowed for medical purposes, and patients allowed to grow their own for some countries, for example, in Canada. There is a growing interest to cannabis as a medical substance in all over the world. First in Canada, in the United States, in several states of the United States, not in all states. In minority states in the United States, there is an interest to medical cannabis. Canada, also Israel, which had a large proportion of people obtaining medical license per capita in the world. Netherlands, where the best system of medical cannabis exists. Finland, Italy are also going to approve medical cannabis in their territory. Czech Republic, Germany, Norway, and last in this year, Uruguay. Among the most promoted countries in the field of medical cannabis, I should mention Canada. that has the most promoted medical cannabis laws. According to these changes, most recent changes, within the last 6 months, the regulations replaced by approvals. So any physician in this country could prescribe medical cannabis according to his own views. Cannabis medical and commercial production is allowed, and commercial interests are comparable to pharmaceutical industry. It is allowed to direct sale to patients who has a valuable prescription. Also, personal grow license phased out will be phased out in April next year. Import and export allowed, which has a huge meaning in the world drug traffic. Over the 100 applications currently under review in Health Canada. I mean 100 applications for new grower in Canada, not in user. Now in Canada we have more than 50,000 of current constant medical cannabis users under the approval of Health Canada. So 50,000 users, current users in Canada, and the number will grow exponentially. In Czech Republic, new law regulations are relevant since this year. This supposed to have a structure that's similar to the structure of medical cannabis system in Netherlands. No personal grow license is issued till so far. Production are performed under the government license and contracts. Import and sales allowed since August this year. The sale is only on prescription through pharmacies, and regulations for local production is expected in April next year. If somebody who have some additions to this, my knowledge, I will welcome it on the end of the presentation. In Norway, the situation is slightly different. The policy in the cannabis changed this year. It is only patients-driven regulations now. There are many veterans of Norway forces that were injured, and patients applied to me directly how I can help them to obtain a license for medical cannabis, and I helped them to obtain the license, but they should import it from Netherlands. But for them, the costs are covered by the government and veteran administration in Norway, and no local production is allowed. In Uruguay, they on the way to the fully legalization, as well as medicinal, as well as recreational. But now only pharmacies are allowed to sell cannabis for a maximum amount, 40 grams in a month for each patient. The prices are about very low in order to provide competition with the black market. So on the current situation, there is some point the government, science and industry should collaborate. About the government purposes, it should be a strict separation between recreational and medicinal uses. The government should allow and support research in the field of medical cannabis. They should strive and to organize international harmonization in order to have the same pacts in different countries, allow the medical cannabis patients to move free from one country to other country, and not to be an object of any kind of prosecution. Also, they should have a proper control and enforcement regimen, allowing this patient to have the medical cannabis. The science are invited to join forces in research. We should have much more international studies in this field. team up with industry and governments and expand research on all levels on all kinds of cannabis and cannabinoids. About industry, it should be produce standardized raw material and production. In the previous lecture, we learned how it's very important to have a very good quality and qualified material out of any toxic or poisoned substances. Unfortunately, the quality of control in my country is very low. In Germany, it's about better, but in many countries that just beginning the program for medical cannabis, like a Czech Republic, it should be the most important issue, how to get good access to medical cannabis of very good quality. Otherwise, it could be just dangerous to all our patients. The industry should create a budget for research and development in this field. Also, they should have continuous improvement of their products and production of methods. And also, with each new substance, they should go through the drug approval process. Here, I am a board member of International Association for Cannabinoids as a Medicine. This association is founded in March 2000, and majority of the members are German and Austrian doctors. We have also fellows from other countries from all over the world. And I invite any physician from any countries who participate in our program here to join our association. Yesterday I was asked about this association. International Association of Cannabinoid Medicine is a scientific society educating the healthcare professionals, advocating the improvement of the legal situation for the use of various cannabinoids and its pharmacologically most important active compounds for the therapeutic applications through promotion, the research, and dissemination of information in all over the world. Yesterday I was asked by somebody from public how somebody could receive the good information, reliable one, on this field. I address you to this site that contains last information of medical cannabis. It is updating about each other day. So I invite you to reach this site free for anybody and to download any reliable and relevant information to you. There is another association, the most reliable source for the relevant information in the field of medical cannabis for clinical and educational purposes is a site of Canadian Consortium for the Investigation of Cannabinoids, CCIC. They have probably the best website I ever seen in this field, containing the last research in this field. Also, I would like to say two ways. I would not describe my my research on post-trauma. I just would like to say that our results were about the same that the group of what yesterday reported. I just say that we have very good results in our post-traumatic study in Israel. Majority of them were veterans of Israel wars. We have more than 55% of global improvement. And I would like to say that patients that have joined pain syndrome and post-traumatic syndrome improved in their majority. So this is a main issue of our study. For results, I say that under combined cannabis and conventional medication treatment, the majority of the patients report discontinuation or lowering of dose of painkillers and sedative pharmacological agencies. The majority of significantly improved patients belong to group with pain or depression comorbidity. No exacerbation of serious adverse event were reported. I should say that there is obvious need for further study in this field. The control studies with THC doing now in Hadassah Medical Center. We should use THC and CBD containing products, not THC only. So I would like to thank you for your attention and invite you to bring me more comments and suggestions. Thank you.
Dotazy? Questions?
Have you, by any chance, administered cannabis in situations of stroke, or have heard of anyone administer such treatment?
Yes, thank you for a good question. As a specialist in neuropsychiatry, I quite frequently invited to bring my consultations to patients who suffer from brain damage. For example, after stroke and maybe some kind of scalp event. So in this category, we supposed cannabis one of the most positive agent for such patients. The problem is that the patients are not educated. The patients are not ready to use cannabis for themselves, and it's a very small amount of these patients are applying for medical cannabis. We have any objection from authorities. In kind of the stroke patients, our Israel Ministry of Health collaborating very well and obtaining and issuing a license very easily because of the highly debilitating level of this injury. Now in Israel we have about 10 to 15 such patients. Unfortunately, because the number of patients who could gain positive effect from such treatments is much larger.
I have a question about anaphylaxis. This is because a friend of mine had a shock like this, and the effect of it was he fell into a coma and he woke up, but the only thing he can do by himself is breathing. He has to be a sound for eat. He cannot eat anymore. He cannot talk anymore. Not here. Is there a treatment with you have experience with?
Thank you for your question. I suppose this is another good example where the cannabis is just unutilized medical substance for such patients. We have some experience with such patients. For my great sorrow, the doctors do not suppose to have a cannabis, to suggest such patient a cannabis. So in the case this patient could be in Israel, we will be ready to suggest him the such cannabis program. I hope it could be helped. Now in Israel we have some comeback of neuropsychiatric indications such as Parkinson's disease, Tourette syndrome, Alzheimer's disease, and we have a lot of patients that now begin to obtain to apply for such indications, and we're trying to help them with cannabis. And now our Ministry of Health pretty good collaborate with this. And I also forgot to mention you that the primary issues in the field of medical cannabis is its educational needs. Educational needs and for patients and for doctors. And I suppose it is mostly important for doctors than for patients, because as soon as doctors will be aware that they have a very good and reliable therapeutic agent in their armamentarium, they will advise it to their patients. Under our associations, International Association of Medical Cannabis, we will try to establish educational center for the doctors in the Eastern and Eastern and Central Europe. And we suppose that Czech Republic could be the best place for such center, just to educational doctors in all countries that would like to put cannabis as a therapeutic agent in their countries. Do you have another questions?
I have another question. Is it possible to make an education in one of your locations in Israel for
Yes,
foreigners?
sure. Yes, sure.
So, what is the first step to do this?
To come to Israel as a tourist. We have a large number of medical tourists and other tourists, and you are welcome to Israel.
Hello, Mr. Reznik. My name is Frederick Polak. We almost met a few weeks ago.
Thank you. Yes, yes, almost. Because I was in Holland about months ago to the wonderful educational activity, which is European Medical Cannabis Masterclass that was held in Leiden about a month ago. I was one of the 10 doctors who participated in this masterclass. This is the first event just occurring in the world, and I hope we could return to this experience in Czech territory. Thank you, Professor Polak. You are most famous Holland medical cannabis physician. Thank you very much for your innovation for this field.
Thank you. I still have a question for you, which is more of a fundamental question about what do you say about whether cannabis should be seen as a herb primarily and not as a pharmaceuticals, a source of pharmaceutical sources of substances, because at least in Holland there is a separate regulation for herbs, for herbal medicine, that is not similar to the pharmaceutical substances. I don't know how about other countries, but you know anything about this?
First, I suppose that cannabis is a part of plant medicine, and as it should be considered also. But as soon as THC is a Schedule 1 controlled substance, it could not be implemented in this field. So this is a contradictory between plant medicine and controlled substances. As soon as this dysregulation could be solved in the international meaning, I suppose many things will be much easier.
Thank you. And may I go on with a second, which is more a remark. You painted the situation in Norway, but I'm sorry that I have to add that it gets a little problematic. Many of the pharmacies that provide this medicinal cannabis to the Norwegian, especially Norwegians, are having second thoughts on it, and it's some of them refuse to do this, and I fear that there will be problems there. But when you say it is allowed or legalized in Norway, they should quickly start to produce it there.
Maybe, but now it's allowed for particular patients who obtain the license to buy it from Bedrocan only. I mean this name of this company because they produce medical grade cannabis of quite good quality, and the government of Norway issued this company and they are ready to cover the expenses in order to individual patient will buy it directly from Bedrocan, not through the local pharmacies, because they're reluctant of local pharmacies to this. And cannabis could be covered, the cost is very high, but it could be covered by the government in the cases of veterans, not of the civil issues.
Thank you. Oh, and
Thank you.
I must say, I'm not a professor. I am glad that you see that in me, but it's not, and I have to correct that, otherwise it seems like I pose as a...
Hi, thanks for coming and making your speech. I wanted to ask if maybe you could tell us about one of the patients that you see in your practice and how cannabis is, what their condition is and how they use the cannabis. Do they inhale it? Do they use it as a tincture? Do they eat it? And then also like maybe how cannabis has like worked on their condition and changed their lives.
Yes, I would like to refer you to the previous presentation of Mimi Peleg. She is the most experienced patient educator in Israel, one of the 7 recognized educators in Israel. So the way of administration of medicinal cannabis are various, you are absolutely right. So we have it in each available forms. We have it as the buds, most popular form, you know, and as brownies in different forms, also, and with oil and with suppositories. So we have very good educators for patients and caregivers. My experience that as better patients and their family members are educated in the way of how to use it wisely and in safe manner, so we have a better results in short way and in long run. But you know, in California you have a medical cannabis program for 20 years, we have it in Israel for 5 years, so we should have a long way before us, but we will not return to your mistakes. We will never return to mistakes of California, where the patients just faked the symptoms and received the license, and this is a system supposed to be vulgar system that compromise all this issue of medical cannabis and just caused a harm effect for any medical cannabis program in the world. Now we try to get rid of this, and also California medical physicians. I spoke with the chief of California cannabis physicians. They just revise their practice in this field, and this is very welcomed. Thank you. Thank you for being with us.
Hello, evening. Pardon me, I wasn't here from beginning, so I don't know if I will ask for some question which have been already told here. So I want to ask you if are there some cases with cancer patients which have been treated or documented? What strain of CBD or THC works better for the cures, like heavy cancer patients like prostate or bone cancer?
So you see, I would like to refer you to the previous lecture, brilliant lecture of Alan from California, who is mostly experienced in treating to some symptoms of pain in cancer patients. For me, I have just few experience with cancer patients, but I would like to say that the ratio between THC and CBD in such patients is not important, that's not important. It is important of individual reaction, how such individual patients perceive this treatment. So we could not know beforehand the sensitivity of his receptors, CB1 receptors. How we could know about it? So this is the only method. We could call it the method ex juvantibus. You should prescribe medical cannabis to such patients to see the results. No harm effect. You could not endanger this patient. He already has cancer problem. So just give him medical cannabis and try to see what's happened with him. And feel free, go slowly, titrate it slowly, and see what kind of results you will see. I would like to refer to previous lecture and saying there is no cure cannabis provide for cancer itself, but it's cure very good some other effects, that side effects of medications, of radiation therapy. It cures very good and alleviate many nausea and vomiting program. Have good feeling of well-being. We are giving now in Israel cannabis as a brownies or as a tea for the small children who are suffering from the hemato-oncological problem, who have leukosis. For them, cannabis preserve very good alternative for other pharmacological treatment. And even their mothers prefer cannabis to giving for small children. This is just obvious results. You have another very good educator. He is also one of the best educators for patients in Israel, this guy.
Now I'm shy. Okay, so if we told about it, I just wanted to say that in this field, I feel that even if tomorrow we will know everyone that we found the cure for cancer and we found the best psychiatry treatment, we have a lot of powers against us that lobbying, and it's okay, and it's fair rules, but there's so much research that what you said, I think it's the only son of light about I know that there is one brain center that collects all information of science, of brain center, and now they are doing it, and cannabis field is the future. It's the future because every country can lower economic cost of medical in F, and we are in a social crisis, and social crisis with alcohol and bad medicine are not good for no family and no country. And what we saw in our 7 years of treating people, and he was there also, we saw that after 1 month till 1 year they take out 50% till 100% of their medicines. So what your research and all the doctors of all countries that work together now can do together is also to educate the world together, and we can bring the money to the same place, the research to the same place, and it will be much easier for all countries to make the future brighter and faster. And cancer can be cured, I saw so many times. You just need to open the brain of the immune system, the cannabinoid immune system that Professor Meshulam found, and it can cure almost every cure if you do it right, organic food, and we can do very good medicine. And I know what's pains. I have like 100% pains all the time from a biking accident, and I use cannabis all the time. 1 year of medicine, I lost my wife, job at the National Theatre. I couldn't walk on my legs after I was a dancer and a singer, only after 1 year. And then I came back to be a biking instructor, to dance, to sing, to walk, I eat only organic, and I live like 100% full life, even I have the worst pain ever living, and I can help other people that have those pain. And no one that is healthy know what it feels, this pain for 1 minute you can imagine, because it will scare you too much. And so we need to help those in pain. for all sicknesses. And take Ilya because he's the only psychiatrist in Israel that fight the strong powers that don't want this cure for psychiatry. And this cure save people to not hang themselves, to not fight with their young kids and wife and people on the road. We can save lives and money and give more love to the world. Yeah.